Administrator. Welcome to today's Mayor's Issaquah Recovery Task Force meeting. I need to pull up the script here that Joanne so nicely sent out. So just give me a moment and I will do that. So I'd like to call this meeting to order of the January 14th Recovery Task Force. I'd like to take roll, so please unmute and say here when I call your name. Jason?
Here.
Marisol?
She just texted me. She's trying to join, but she has technical difficulties.
Okay, thank you. Mike Brennan? I thought I saw. There he is, waving his hand. Hello. Nina Milligan?
Here.
Thank you. Hi, Nina. Pavel?
Here.
There he is. Hi. Saket? I don't see. Brookie Scholl is not going to join us, but I see that she's here. Hi, Brookie.
Hi there.
Grace Chen? Don't see Grace. Janine Sanders is excused. And Shashi. I see a light on in your living room, Shashi. That means your power must be back on.
Yeah, it is.
Oh, that's great. We've had a lot of folks without power. Hopefully most of them are coming back online this afternoon. In addition, do we have any of our alternates? Marlene, is she here?
I'm here.
Oh, are you? Hi, Marlene. Ron Paul, I saw, I think.
Wally?
Yes.
This is Trish. I'm a regular, and I didn't hear you call my name.
I'm sorry, Trish. I skipped over you. I was so excited that Brookie was joining us that I skipped right over you. So
Yeah, no problem at all.
great to see you. Happy New Year. And then Stephanie Salmon. I don't think I see Stephanie. And if folks, if you could put yourself on mute, I think there's been somebody, I think they took care of it. So thank you. In addition, I'd like to acknowledge the staff participating in today's call, our Executive Assistant, Joanne Biscara, David Mitchell from our cable TV operations. We also have several city staff that are liaisons to our boards and commissions, our Parks and Recreation Director, Jeff Watling, our Economic Development Manager, Jen Davis-Hayes, our Human Services Manager, Monica Negrilla, our Senior Transportation Planner, Stephen Padua, our Recreation Supervisor, Kathy Jones. And then we also have several members representing our boards and commissions, Kathy McCory from the Economic Development Commission, Derek Franklin from our Human Services Commission, Bradley Book from our Parks Board, Cynthia Crafts from the Transportation Advisory Board, and Sean Fan, Del Gardali, and Ryan Remy from the Youth Advisory Board. And I apologize if I have done, I'm seeing giggles, so I apologize if I've done a bad job with some names. Anybody I didn't call? I think it looks like I covered pretty much everyone who's on the call. So thank you very much for joining us this afternoon. The next item on our agenda is the approval of the minutes of November 11, 2020. Is there any objection to approving the November 11, 2020 minutes, which were provided in the online agenda? Are there any objections?
Yeah, there's just one correction, Administrator Bob Quitz, on page 6. Other business minutes state next meeting will be held on January 14th, 2020. Any of us here want to relive 2020? So if we could time warp back into the present day, that would be good. That'd be like awful Groundhog's Day. So
yeah, or could we have imagined that we would be sitting here a year later in January 2021 even talking about these things? So thank you for that correction. We'll make that administratively. Any other changes or corrections to the minutes? All right, hearing no objections, the minutes are approved as presented. Next, we have public comment. Joanne, has anyone signed up for public comment?
No, no one has today. Thank you.
All right. So we'll move on to our agenda items. We've got lots of things to cover. Chris Bowden, the Chief Operating Officer of Swedish Issaquah, will be joining us a little later. Joanne, do you know what time Chris settled on his availability to join us?
He'll be at the meeting roughly around 4:30.
Okay, great. So in interest of his time, I think when he comes on, we'll take a a brief break as to wherever we're at in the agenda and let Chris join us. He's been kind enough today to come and give us an update on a whole variety of issues that Swedish is dealing with. So I know you'll be interested in hearing him talk. So I'd like to move on to the board and commission recommendations to the task force. Just as a reminder, at the last, actually 2 task force meetings ago, the mayor asked that representatives of our key boards and commissions go back to their groups and talk about what items should be included in the city's 2021 work plan dealing with the pandemic. We had representatives from our boards and commissions join us at our last meeting I guess it was in November. And then now here we are in January. Hopefully those boards have all had a chance to meet and chat. And we have representatives joining us today to report back their thoughts and suggestions. I've got a PowerPoint that Joanne was kind enough to put together. Joanne, do you have that handy? If not, I do. All right, there we go. So we'll walk through each of the various groups that we have here. The first, I think, Joanne, is the Economic Vitality Commission, and that is represented today by Jen Davis-Hayes and Kathy McCory. Jen or Kathy, would you like to go ahead?
Kathy's going to present.
Okay. Thank you, Jen. Thank you, Wally, and thank you, fellow commissioners. I have just a brief report from our Economic Vitality Commission, and we basically believe that the city's focus should continue to provide support and resources for businesses and property owners as the pandemic restrictions continue to negatively impact them. Additionally, we would like to see additional funding if stimulus funding is provided to the city. Continue regulatory relief, i.e. permit requirements and waived fees, such as we've been doing for the restaurants for streetery, etc. Analyze and support needs of our virtual workforce, support return to work and school, and instill hope. Utilize city communication tools to the highest business, to highlight, business success stories, big and small. Businesses, need to know that they're not alone and that there's hope out there, that there are those just warm fuzzies. We can't hug, we can't handshake, but we can certainly share warm and heartfelt stories. And that's all we have to report. Thank you.
All right. Thank you, Kathy. Any questions or comments regarding that? We'll come back at the end and have a larger discussion about all of the proposals to get the feedback from the task force. But are there any questions or comments specifically for Kathy or Jen? All right. I'm not seeing any hands. Joanne, you'll help me as we go back and forth through different. We use the Microsoft Teams all day, and then we use WebEx in the afternoon and evening. So, great. Thank you very much, Kathy. Next is the Human Services Commission, Monica Negrilla. Monica, I think you had indicated that Derek, the chair, was having some issues with some power in his home. Can you go ahead and walk through what the commission has discussed?
Yes, absolutely. Thank you. Wally, so the Human Services Commission met in November, and our chair, Derek Franklin, sought input from the other commissioners, and the members agreed that as we continue to respond to the needs of the community during COVID, food and shelter, mental health services, language access, and safe haven from all forms of violence should remain focus areas for 2021. And along with that, the Human Services Commission also thought that there are some other related items that should be of priority, and they recommended that in general, public health and safety, whether that is related to any civil unrest or anything, should be of focus for our city, along with just continuing communication and resources in timely manner, continuing the work on police reform and safe reopening. So this is a brief summary of the items the Human Services Commission put forward, and we are available for questions. We also have Trish Bloor, is part of the Human Services Commission. If anyone has questions, we are both here and available.
Great. Thank you, Monica. Thank you, Trish. Any questions for the Human Services Commission about their priorities? All right. Thank you again. Let's move on to the Lodging Tax Advisory Committee. Jen Davis-Hayes is here on their behalf. Jen?
Hi, good afternoon. We're still going. Good afternoon. So the Lodging Tax Advisory Committee is, as you may know, focused on the hospitality and tourism industries and encouraging people to visit Issaquah. Of course, during this pandemic, it's been a real challenge with the things going on. And so the real focus this year will be to continue to highlight the safe outdoor activities. So looking at regional visitors as appropriate to the current phase. And so we have worked with our partner, Visit Issaquah, to refocus and their activities and reduce the financial investment because of the reduced workload. And we also want to make sure that when things open back up, that our current tourist attractions still exist for us to enjoy. And so we are funding $50,000 to support those. They did that they will do that, in spring. They also provided another $52,000 that was allocated in the fall of 2020 to support our regional attractions. So we look forward to, as things change in that industry, adjusting and helping those businesses and organizations to open back up and provide a community resource for all of us.
Great. Thank you very much, Jen. Any questions about the LTAC recommendations? All right. Seeing none. Thanks again, Jen. We'll move on to the Park Board. Jeff Watling and Brad Book are here. Jeff, Brad, go ahead.
Yeah, thanks, Wally. This is Jeff Watling. I'll give a quick overview, and Brad and I are here to answer any questions. Marlene, also a Park Board member, is part of these conversations. So we, I guess, in our discussions, sort of identified an overall theme of, along with some of the capital projects we already have planned, but how might we do some further activation of our city parks and trails, and creating opportunities for residents to exercise and or connect with their community, with fellow residents in safe and healthy ways as we navigate through the coming months. These 5 ideas are both sort of some projects as well as maybe some programs we might want to consider. Again, the idea of low cost opportunities. One would be how might we incorporate some outdoor fitness equipment along one of our trails or within one of our parks. There's a number of vendors now who provide a variety of really low cost equipment that can provide multiple exercises at any one station. Also, how might we look at converting or just restriping or adding striping to some of our tennis courts to add pickleball and other perhaps multi-uses to tennis. So they'd still be tennis courts, but maybe create some further versatility with those courts. Programmatically, how might we look at doing a scavenger hunt or geocaching sort of celebrations, contests throughout our park system? Also an idea of utilizing some of our trails and creating a sort of walk and learn tour where we might pick multiple, 3 or 4 trails and throughout the year create flexible, portable, interpretive signage that could educate, tell a story in various places throughout our trail system. Brad's got some real creative thinking around that if we wanted to further nurture that. Another item that came up that's already on our work plan, but our summer concerts, our concerts on the green that we unfortunately had to cancel last year. That's in our budget. We want to continue to plan with our partners, Kiwanis and others, not think of this as just an on and off switch, but if we are to need to modify what those concerts look like depending on where we're at in COVID recovery. We want to be really flexible and be able to, at a minimum, still provide a modified concert on the green program. So staying flexible with that program. That's a really quick overview.
Great. Jeff, Brad, do you have anything you'd like to add?
Unmute, Brad.
I support all of these, and actually the only one that I had any maybe further discussion on would be the walk and learn tours, which is really something as an extension of what's going on now at the Lake Sammamish State Park. Our Friends group actually has a special trail situation set up for Martin Luther King's observation here this month. And that's actually kind of what prompted the concept of doing something like that similar in various parks and trails within our park system. Probably more with a different focus, that might be related to Issaquah history as a learning opportunity, also some potential Native American cultural things. Certainly a strong item within our valley here. Also, wildlife. We could link up with Woodland Park Zoo that's actually currently doing a program with coexisting with carnivores. We could extend from that. Native plants, habitat issues. There's an awful lot of environmental type of things that we can use for that program. It's actually something that I'm interested in as a potential test as we focus on the Issaquah Creek corridor, for instance. We're in the planning stages for that, and to actually incorporate some interpretive elements to our trails to create a learning opportunity, gives people more of an opportunity to get out and about on our parks and trails and actually learn while they're doing that. So that's one of my interests anyway.
Great. Thank you, Brad. Some questions. Nina Milligan to start.
Thank you. This is Nina Milligan. Thank you for all these great ideas. I love all of them. My question regards who does these? Does the city do them, or can they be farmed out to programming providers so that we provide the place, the park, and the people, and somebody else brings in the services of conducting these activities or tours? Brad talked about the history. Could the history museums, for instance, be the ones who are providing the tours, just as an example?
Jeff, Brad, thoughts?
Yeah, Nina, great question. I think so much of what we do is done through partnerships. So I think even as we talked about these ideas, it's probably all done in some semblance with a partner, right? How do we provide what we can provide, but also lean on others and do it in a partnered way. So yeah, absolutely.
Great. Thanks, Jeff. Jason Voss, question.
Close, Mr. Bobkowitz. It's voice, but you're close.
I'm sorry.
That's okay. So no, actually, building on Mr. Watling said, I thought it was pretty interesting, the walk and learn tours. It reminds me of kind of the museum, right? So you put in the audio guide and you walk around and you see number 33 on the trail, you hit it and it provides a story. I don't know who could possibly do funding for something like that, whether the city could, but obviously you'd have to rent the audio book. You could either get cheap headphones like the ones they give out on planes. But that could be interesting. I mean, it wouldn't be a big source of revenue. And yeah, I'm sure you could even develop an app for that, where people could go, again, through the trails. They could go to different historical buildings, different historical sites, whether they be Native American, whether they just be Issaquah, when it's founded as a logging town, things like that. But that could be interesting. And that would definitely provide something as far as tourism to our city. I think it would. I'm not aware of it happening in any other city, so possibly could even be a leader with something like that. And again, basically build off the model of a museum. So I think that would be pretty interesting.
I love that brainstorm, and you're absolutely right. And I think as we are in the midst of doing our pop-up dog park tour, this whole idea of how do we do portable stuff? I think this this first bite of walk and learn is how do we, again, work with partners on content and what is the content, and how do we pilot some of these throughout our parks and trails, see what the community response is. But you're right. I mean, it could evolve into so much more. But Brad is such an advocate of history and culture, and I am too. And we constantly talk about with park staff and the board is our public spaces should tell a story. And we're really about placemaking. And placemaking is not only the physical space, but I think history and understanding our history is a big part of placemaking too. So there's some great opportunities to tell stories and the history.
Yeah, and I know the city is also interested in putting up more wayfinding signs. And again, if you have wayfinding signs through the trails, they could explain the history of the trail. Thinking about Pickering Barn, things like that, where you could have an app, and apps are getting cheaper by the day to develop an Issaquah municipality or Issaquah city app. And again, you could download a tremendous amount of information about our city, and I think it would drive tourism. And again, I think we could be a model for other cities.
Great.
So,
Love it.
Yeah, I really like that idea, Jason. I've been exploring QR codes, which is actually kind of a little outdated, I suppose, but at least it's still a good opportunity to share information. I've been working with the Native Plant Society to actually maybe include something like that at our Native Plant Interpretive Trail at the state park. And so that's another potential way of actually, having a fairly inexpensive way to provide an awful lot more learning opportunity beyond just what a sign could do. But a sign could be, really talking about the highlights and then drill down into more information either through QRs or through, apps, which I'm not that familiar with how all that works, but I really like that idea. Something that can really go well beyond just this park opportunity.
Great. We've got a few more questions. I want to make sure that we've got a few other groups to hear from as well, but next is Sashi with a question, comment.
Yeah, thank you, Wally, and thank you, Jeff and Brad. Very good information. I like everything on your list here, particularly the outdoor fitness equipment. I had been always thinking to do exercise on equipment outdoor is really more healthy. I had stopped going to some gyms just because of overwhelming, bad air in the closed spaces. So I think it would be a permanent thing we can do every summer because it rains a lot here. We could have a tent, some kind of thing over our heads and fresh air circulating on all of the sides. Great idea. Everything is good. Thank you so much.
Great. Thank you, Sashi. Trish.
Unmute here. Yeah. Okay. I'll make a quick comment. And Jeff, you probably know about this. We used to have a publication that talked about the different art installations, and people could walk around the city and view the art installations and, get some background on them. And it's been a while since that publication has been updated. So you might talk to Amy about that if that's something, but I think that would be great.
Great point. Thanks.
Ron, do you have a question or comment?
Yeah, so I'd like to build off of what Jason said about the apps. I think that would be a really great way to do it. Apps are getting very cheap. You can do barcode. So when someone gets to an area, you can just have a little barcode. They scan with their cell phone, and it gives them either video or audible presentation. And yeah, cool, Jason. I like that.
Great. Thanks, Ron. Marlene, a comment?
Yes, just building. I think everybody's excited about that idea. I would just add, for those of you guys who are familiar with the Swamp Monster Trail, and it's stuff that's good for kids too. It doesn't always have to be all informational nonfiction, but maybe throw out, the idea of how are you changing up even, stories that are in the public domain that promotes literacy and getting kids outside in a fun way that kind of adds to the interactive nature of the parks or trails. So just want to throw that idea out as well.
Like you could almost do like a kids one where like Sasquatch lives here, for like under 10-year-olds, like the legend of Sasquatch or something like that.
Yeah, there's a lot of fun things you can do too. I mean, yes, of course, history and nature and all that stuff is amazing, but sometimes just a little fun and levity. Just would want to encourage that as well.
Great. Thank you. And then Jen Davis Hayes, you're going to end us off before we move on. Do you have a comment?
Yes, I just wanted to mention that actually the LTAC funding, as I mentioned before, actually is funding a digital geocaching tour. I just sent information to Jeff for this summer. And so the upcoming grant fund may be able to fund some of these ideas. We also have a contract with the Issaquah History Museum on an ongoing basis. So really appreciate you guys' ideas and thinking about how the community can implement these, because we have some opportunities to put these in place.
Great. Thanks,
That's
Jen.
great, Jen.
All right. Well, thank you both, Brad and Jeff. Great comments. I'm sure we'll talk more about them at the end as we look at the task force's priorities. Next, we want to move on to the Transportation Advisory Board. Stephen and Cynthia, who's going to take up these points?
Thank you. I'm going to actually do a quick overview and then ask Vice Chair Cynthia Crest to add on if I miss anything.
Great. Go ahead, Stephen.
So the Transportation Advisory Board met last November, and the overarching concerns that the board expressed were that people are seeking a lot more options to walk and ride bikes in their neighborhoods more than ever before, which has emphasized several issues that were highlighted in the development of the Mobility Master Plan. More could be done to improve the environment for people who want to walk or ride a bike throughout the city. And so the board's recommendations include exploring low-cost improvements at existing signalized crossings for pedestrian cyclists. This could be looking at wait times, or another suggestion was to look at the addition of crossing countdowns to help kind of manage the expectations at crossings. Another idea is to pursue a Healthy Streets initiative, which identifies routes through neighborhoods that improve the environment for people who want to walk or ride a bike to and from their homes. And that way it works. So the city would look at routes through neighborhoods and use signage to limit and control vehicle access. Another suggestion or recommendation from the board was to look at wayfinding to support a lot of these non-motorized improvements. But I've already confirmed with the Parks Department that this project is already underway. Just to let the Recovery Task Force know. And then the other overarching recommendation from the board was that all the neighborhoods should be explored for much of these improvements, but priorities should still go to supporting our local businesses. So looking at prioritizing the commercial retail areas like Old Town to maximize kind of the community benefits for future streetery type activities. Cynthia, did you have anything else to add?
No, but thank you.
Great. Thank you both. Any comments or thoughts on the recommendations from the tab? All right. We'll, again, talk about all these at the end and get some priorities from the task force. I think Chris has joined us from Swedish Hospital. Chris, are you there?
I am here. Can you hear me?
I can hear you. Great. Thanks so much for joining us, Chris. Mayor Pauley had something come up, and so she was not able to chair the meeting today. So I get the honors. But I think many of you know Chris. He's come before the task force before. Probably has the hardest job in town, managing all that's going on at Swedish Issaquah. So, Chris, we really appreciate you coming today to provide the task force an update. Really on all things that you're dealing with the COVID crisis, with vaccinations, anything else you'd like to share. So the floor is yours. Thanks for joining us.
Well, thanks for making time for me. I'm starting to recognize some of the faces when I get on these calls, so that's a that's a nice thing. And I apologize, I'm a little hoarse. I just got out of a 3-hour meeting where I was speaking a lot, so I'll do my best to project. Well, things at the hospital are actually going quite well right now as it relates to the pandemic and COVID. 2 weeks ago, I was much more concerned as our inpatient census with COVID patients was really spiking at the time. But since that time, our number of admissions have gone down, and we've discharged quite a few patients. So our levels of COVID patients are quite moderate and manageable right now. But a couple of weeks ago, we were running at volumes that were higher than we were in the spring. And we were also, those patients were coming in and leaving sooner, which was a good thing. But that just kind of also tells you how many more patients were coming in at that time as well. So in total, this year we've treated somewhere north of about 300 COVID patients at the hospital. Most of those patients have gone home, which is a great thing. And I think we've certainly gotten better at caring for them and getting them out of the hospital sooner. Originally when we started, patient would come in with COVID, they were there for, sometimes upwards of 17 days on average. And now patients are coming in, they're leaving in about 4.5 days. So really much more kind of normal hospital operations. Still have some patients going to the ICU that are very sick, but not as many as we did early in the spring as well. So really those are some positive trends. In the last 2 weeks, maybe last 3 weeks, we've really pivoted our focus from, well, not pivoted our focus, we're still taking care of the patients in the hospital, but now we have vaccine distribution and administration to think through as well. So I am happy to report that, across Swedish and our 5 campuses, we've given about 26,000 doses of vaccine at this point. All our caregivers and providers that have wanted to get a vaccine at this point have had the opportunity to get one. And over the next couple of weeks, we will finish second dose vaccinations for those caregivers as well. So my hope is that by the time we hit Valentine's Day, the healthcare workforce will really be largely protected in the community, which is a good place to start because, as you might imagine, like everywhere else, we've had our own challenges with folks that have gotten COVID and had to go on quarantine and stay out, or gotten sick as well, and that's compromised our ability to be able to care for the patients that come in or sick. So already we're starting to see a few less people that work at the hospital go out with COVID infection. So I think we're already starting to see a positive, and that's what I really will be kind of the first really positive inflection point in the pandemic that we've had for a while. The other positive thing is those members of our community that reside in skilled nursing facilities and adult family homes are in the process of being vaccinated as well. And those are the patients that have certainly been the sickest when they've come into the hospital. Those are the patients that have been most likely to pass away due to COVID. And those are the patients that are also sometimes the hardest to discharge from the hospital because skilled nursing facilities and adult family homes are trying to manage outbreaks as well, and they can't always take the patients back in the time frame we'd like them to. So it's all a system in healthcare, and you've got to have throughput and be able to move patients to the right side of care. But I'm cautiously optimistic that things are getting better, and some of the reports we're seeing in terms of test positivity rates are looking better as well too. So my hope is that we've got a little glimmer of hope out there on the horizon, and I think the vaccines are going to help with that. I will say we're starting to think critically now about how Swedish and other healthcare organizations in the area begin what will have to be a massive mass vaccination effort to take place over the next year. And the numbers are a little staggering. There's 7.6 million people in Washington state. Everybody needs 2 doses of vaccine. That means you got to give 15.2 million doses. You want to get that done in a year, you got to give 40,000 plus doses a day. It's a lot of vaccine to put into people's arms. And so just this week, Swedish Downtown has partnered with Seattle University. We stood up our first community-based vaccination clinic, right now focused on other healthcare professionals that are in the 1A phase. And we're vaccinating a couple thousand people a day down there right now. So we're doing that centrally downtown first. We're learning from that. And then we're actually having discussions with both the city and the Issaquah School District about how we might replicate that in some way out in East King County as well. So with the idea that we'll be able to do something similar to that. Now, we are still following all the guidance set by the governor. We're not going to move any faster than the governor or the Department of Health allows us to move. So as we move through different phases, as different guidance comes down, we're working on ways to get vaccinations out to the community. but it's going to be a massive effort. And truthfully, it's not going to be the healthcare system alone that's going to be able to do this. We don't have the resources to put forth to vaccinate 40,000 people a day and continue to run hospitals and doctors' clinics. It's just not, the labor force is not there. So the one thing that's come out of the work at Seattle University is really a massive volunteer effort. And so we have volunteer portals where we're taking both medical and non-medical people that are willing to volunteer and come and work with community partners like Swedish and others to get this work done. And I think it's really exciting, and it's going to be really challenging. And I think sustainability is going to be a big deal because, again, we've got to do 40,000 a day for 365 days if you want to vaccinate everybody. That's a big task. And so the immense or kind of enormity of the challenge is out there, and it's going to continue to be bumpy. I mean, everything we're hearing from both the federal government and the state government is kind of telling us that this is going to be bumpy for a while as we set up these systems and processes. And right now, the vaccine is not kind of the rate limiting step. Actually having people to put vaccines in people's arms is the rate limiting step at this point. But do know that we are pivoting and we are making the change. And as we get to those different phases, we are going to be trying to respond and work with different community members to get it out to people in the community. And hopefully, as you think about it from a business recovery standpoint, these are really the first things that are going to help us reopen the economy in a meaningful way. And I think we can all do our part in mask and distance, but the more people we can get protected, the better off we will be as well as we move forward. So that, in a nutshell, is kind of what is going on at the hospital. The good news is we've managed to do vaccines, take care of COVID patients, and we haven't stopped services like we had to do in the spring. So we are kind of running in a full service operation right now. All elective procedures and surgeries are happening as they would normally. And we've been able to navigate that over the last several months. So a glimmer of hope on the horizon, but still, a lot of work to do to kind of get through this next phase. I'd be happy to take questions if the group has them.
Great. Thanks, Chris. Really appreciate you joining us today. We do have some questions. Jason, go ahead.
I apologize. I'm probably going to butcher your last name, Mr. But how do you pronounce it? Badwan. Thank you, Mr. Badwan. I'm sure I can speak for everybody on behalf for your team and your tremendous efforts in keeping our community healthy. What a tremendous undertaking you guys have just through 2020. It's something. I did have a couple quick questions. I've noticed mobile pop-up sites in other areas. I'm reading the paper. I mean, Israel has done a fantastic job vaccinating their population, but I've also noticed that, a very small portion of people have adverse side effects. How would a mobile pop-up site work if you do have, like a drive-through where people are being vaccinated? Because like you said, to get to 40,000, the idea of people being able to come into a building it seems like that wouldn't be the way to do it. At some point you might have, especially in the summer as the weather allows, you'd almost want mobile pop-up sites.
Yeah, no, I think that's the way everybody's thinking, Jason, is bigger sites, mass vaccination clinics, meaning you're not calling up your doctor for a vaccination. You're going to a vaccination site most likely. And there's a lot of challenges related to the stability of the vaccines as well and what you can actually do. I mean, once you puncture a vial, you have to use that vial within 6 hours or it's no longer any good. So it's not like a flu shot. Calling your doctor up and getting a flu shot, it's not the same thing. It's not going to work the same way. So we've done all our employee clinics. We've learned from that a bit. And we have, what we've done is we have RNs that, trained RNs that observe everybody for 15 minutes after they get the vaccination. And we will do something similar to that in these pop-up clinics. And I expect you will see things like having EMS transport on site at these different clinics as well. I mean, a lot of these details are still being worked through, but there's going to have to be some sort of observation period of time. Now, the good news is that our adverse event rate is extremely low. So that is true. It is higher with the second dose. We are seeing that. which has also kind of been reported. But there's going to have to be, clinical people that are engaged in these sites, clinical people that are overseeing both administration and observation afterwards. And we're actively planning for that. And they've been doing that this week down at Seattle University.
And then one other thing, Mr. Bedwan, is for people that aren't, again, because these have a shelf life, I don't know if there's any conversation about it. And obviously this would have to go through the state or through health professionals, but I wonder if there's just like a certain amount of vaccine that could be just tucked away for people that want it, right? Rather than throw away or toss these, which we've heard these stories coming from New York where they're tossing or destroying vaccines. It almost seems to me like, okay, you have X amount that are ready to go. They're not being used. People can stand in line and get them. If there was like some type of way to keep track of those individuals, okay, now that you've been inoculated once, okay, you do get your second dose in a month. I don't know if that's even being talked about, but what a tragedy to hear some of these vaccines are being destroyed because not enough people are taking the opportunity to go get them. And like you said, once you pull them out of the freezer, the deep freeze, you only get so much time with them. I don't know if that's even being talked about, but again, I hear some of this stuff coming from Israel, which has done a fantastic job. And obviously the vaccination program in the United States is getting off to a slow start.
Yeah, I can tell you our experience at Swedish. We've wasted very little vaccine in situations like that. The other challenge is though is it's not really the 6-hour challenge. It's a 1-hour challenge. Once you pull that vaccine up into a syringe, it's good for 1 hour. So you better have somebody pretty close by to give that vaccine to. The way we handled that with our employees was, we identified, a handful of people ahead of time that might have wanted their vaccine that day that weren't signed up to actually get it. And so as we managed our queue of people coming in and our appointments, we would take walk-ups. And then as we got down to the last hour of the vaccine clinic, we would begin to draw up syringes one by one so as not to waste. But then, each vial had 10 doses. So once you punctured the vial, you kind of commit to the next 10. But we identified people locally. That gets much harder when you're doing it on a community basis. And 1 hour is not a heck of a lot of time to track people down. So I think wastage will be a small issue because I think we have our processes down fairly well. Now, if your freezer breaks or something, that's a different issue. But I think we have pretty good control over that right now. And certainly by the time we get to a mass vaccination clinic, I think we'll have the majority of those challenges worked out.
Great. We've got several other questions, Chris. Next is Ron Fall.
Good afternoon, Mr. Vedwan. This is Ron Fall. So 2 questions, and to kind of build off of Jason again. I like the idea of mobile pop-ups, like a drive-through. We may be able to do something like that at Lake Samammer State Park. So that would give you the parking space and so on. I'm not volunteering that because it's part of state parks, but that might be a great place to do it. And then second of all, the brain fade. It was partnerships. What is, because for instance, I'm with Kaiser, but my Kaiser is down in Bellevue. Is there any discussion of possibly doing a partnership with someone like Kaiser, another healthcare organization, so that we could tag team? That way we could be community based and we keep, like we cater to Issaquah residents, and Kaiser may be able to cater to the Bellevue residents, and that way people aren't driving all over the place to get these vaccinations.
Yeah, so we're talking with multiple different organizations, some other healthcare organizations, some community-based organizations. It's going to continue to evolve over the next couple of weeks, I think, as different organizations get ramped up in what they can do. The Seattle University effort was really our first one with a big partner. But again, when you get to these, scale really matters when you think about the number of vaccines you have to give and how fast you have to give them to make a big difference. So while I think there will be multiple sites eventually, there's not going to be probably hundreds of sites of these. There's going to be, a select few that are very high volume. And, I think as the healthcare system gets ramped up to do this, as community partners get ramped up to do this, there will be more and more partnering about this. There's a lot of conversations going on about topics like you just talked about right now. But there's also probably the primary effort going into getting the workforces vaccinated first. And Swedish is kind of, just about at the end of that. And as we get to the end of that, we're really going to refocus our attention then on getting the community. So I think it's a great suggestion. All I can really say with any certainty is I know there's a lot of conversations happening about those types of partnerships right now.
Great. I think we've got 2 last questions, and then we'll let Chris get on with his day. Sashi, go ahead.
Thank you, Christopher. Very good information. I have a question about, I'm following Dr. Campbell. If you know John Campbell from England, he's giving every day update on world scenario about vaccines and a lot of other things. So now I wanted to know what vaccinations are we giving? Are these all Pfizer, or Pfizer and Moderna, or also Johnson and Johnson is coming up? It seems that requires only 1 dose. And then Oxford, which can be kept on room temperature, is much easier to handle. And this was my first thing I wanted to know. Second one, so many have been vaccinated already so far. So have you seen what kind of serious side effects have you seen so far, and deaths? Because I think whatever I have read, this particular vaccination is like 4 times more deadly than other vaccinations in general. Like out of 270,000, it seems 6 people died. And that's why some people are very scared about it. But yeah, definitely it's taking risk either way, and definitely getting vaccination is much better. I'm waiting for mine too. So could you give us some take on that?
Yeah, I can't specifically answer your side effect or death question because I just don't have the information in front of me. I'm not aware of any deaths that we've experienced since we've given it, but I don't have the information in front of me either, and I haven't looked at it. And so I just can't specifically answer it. What I can tell you is that in terms of the manufacturer of the vaccine, we are using both Pfizer and Moderna vaccines. And so you place orders for vaccines, and then you kind of get what you get sent, and the state gets sent what they get sent too. So the whole process to trying to get the vaccines and understand what's coming when is actually a fairly challenging thing for us to deal with, because states aren't always getting a lot of notice. Because the states don't have a lot of notice, we don't have a lot of notice. And so it's a little bit hard to plan, but I expect that'll smooth out over the next several months as well as more supply comes online. And I expect that we will likely be utilizing all brands of the COVID vaccine, assuming they're proven to be safe and effective. Right now, the 2 that we're using are roughly equivalent in terms of their efficacy. As long as they're effective and they're approved by the FDA, I don't expect that we would, at least in this first year, be more interested in one manufacturer than another, simply because you're going to need all the manufacturers to probably contribute to be able to vaccinate the population.
Great.
So if you're
Thank
getting
you.
information on side effects and/or deaths online from a reputable source, that's probably about as good as information as you're going to get, because it's going to encompass a wide swath of the population, have a much bigger sample size than even I'd be able to share with you from Swedish.
Great. Thanks, Chris. Final question from Brookie Scholl.
Hi, thank you for joining, Mr. Bourdoin. My name is Brookie Scholl, and I've been working as part of my day job with Challenge Seattle and trying to get some of the large corporations in the area to help do these mass vaccinations. And we have huge interest from the employee base to volunteer to help. And obviously they wouldn't be able to volunteer to do any sort of medical piece, but to take the information, do name checks, just kind of help with that. So I'm curious if there's opportunities for citizens of Issaquah to help with Swedish when you get to that point, I think that people want to help. And so if there are opportunities, I think this is the right group to use to try to get that word out.
There will absolutely be opportunities. We will have to rely on a lot of volunteer help to do this, both medical and non-medical. We have, through the Seattle University partnership, again, just over the last week and a half, set up a complete sign-up process with a third-party vendor that manages all the volunteer sign-ups and making sure that we have the right people and enough people to run these operations. We just opened the first clinic 2 days ago down there at Seattle University. I haven't seen it yet. I'm going to go down there on Saturday and look at the operation. But we would probably, assuming it's going to work, we would build off of that framework, and there's going to be more opportunity than people know what to do with. We've had an immense amount of response in the first couple days, like more people wanting to participate than we have slots for. But this is a long game too. So there's going to be plenty of opportunity for people that want to participate as volunteers to do so. And I would be happy to share that as we get a little farther in our planning about what we may do on the east side.
Great, thank you.
Yeah, this would be a great group to bring it to, and we would welcome the help.
And we'll talk more toward the end of the meeting about the mayor's community vaccine partnership. Swedish is a part of that, along with a number of community partners already, and we're already talking about the volunteer piece. So I'll talk a little bit more about that toward the end of the meeting. Unless there's anything else burning, Chris, thank you for taking a few minutes out of your day to join us today. We really appreciate Swedish's commitment to Issaquah and all the good work that you've done. So please share with your colleagues how much the community appreciates all the good work that you've been doing. So thanks for joining us. Thank
you. We are here to serve the community, so we're happy to do so, and appreciate this group and the opportunity to come, and have a nice evening.
Great. Thanks. You too, Chris. All right, let's go back to our board and commission review. We still have one last group to hear from, and that's our Youth Advisory Board. I'm not even going to try last names again, so I'll just say Sean, Dell, and Ryan. Kathy, who's going to speak? How are we going to handle this?
They are ready to go, so I will let Sean, Dell, and Ryan go for it.
Hi, I'm gonna start. I'm Dell. It's really nice to meet all of you. This has been like an amazing experience for all of us, so we're really grateful for you inviting us. This is just what the board talked about at our last meeting, just some of the points that we want to see the city, talk about and like discuss a little bit and maybe implement into what we're gonna do in the next few months. So the first bullet point is surveys. So we were just talking about how it's like the board's like responsibility to check in with our citizens and our residents and stuff. So that combines like mental health surveys, check-in surveys, and park surveys. I am going to talk about mental health surveys a little later, but it's just like seeing how the family's doing, how you are doing, and just kind of get that information to the city and then see what we can do from there. And then check-in surveys, just what, big challenges the families are facing, whether it's like income problems or anything along those lines. And then park surveys, Jeff was talking about like a lot of good stuff that we had brought up in our own meeting. And just like what improvements or what like programs you want to see in the parks. Just as the summer comes along, as the spring comes, we want to get out and about a lot more. So yeah. I think it's Sean. I think it's Sean next.
I think it's me. So hi, everyone. I'm Ryan. I'll again echo what Del said. It's really great to be back with you all again today. So another point that the board talked about at our last meeting was supporting small businesses. And there were sort of two components to the things that we brought up at our meeting. The first of which being making sure that these businesses have the supplies and materials they need in order to reopen safely and sustainably when they can. And the second component to this was awareness. So whether that's utilizing social media to connect with younger age groups, as well as just the general community to make sure people know when small businesses are open, and also highlighting what was previously said with the Economic Vitality Commission in terms of highlighting success stories as well through social media and just sort of letting the community know of how things are going with small businesses.
Cool. Okay. Hello, everyone. I'm Sean. And I just want to reiterate the point that we as a youth advisory board has discussed this in our meetings, and we thought from the youth perspective, but really thought about this for all aspects of the community, not just for the youth. So that brings us to a little bit more of a mature point, talking about job training and placement assistance. So one of our groups had the brilliant idea of thinking that the city was in a great place to be sort of encouraging the big businesses that we have near Issaquah and that is Issaquah citizens are employed in, to be releasing information if they need sort of just like job training, if they have job training opportunities, if they have job openings, and sort of relaying that information to Issaquah citizens. And I think, or we thought that the city was in a great position to do this, and just like the relaying of information, definitely something that we as a youth board think a lot about. So that's sort of the point on that.
Okay, so for environmental practices, this is going to be super quick. The Issaquah Youth Advisory Board is really excited to see the new environmental board come up. A lot of our kids wanted to join, but obviously there's only 2 spots. But we're super excited to see what you guys do with that. So yeah, and we're happy that the city has kept the environment as a top priority too through these difficult times. Back to mental health and surveying. The board was talking about not only focusing just on teens, but also on adults, and just checking in with adults as well, because there's kind of it's always focus on the teens as what I've noticed, and adults need help too. We're all going through it together, so just checking in with our adults, seeing how we can help you guys as well. One of the board members actually said that she received a flyer in the mail, just kind of checking in with her family and her and giving a suicide hotline, putting information for what people need, people they can call, organizations they can call if they need help, especially with the suicide rates exponentially increasing through COVID times. We do need to find a way to kind of lower those and kind of battle that issue that we're seeing in the community.
So another point we discussed was Wi-Fi and broadband access for all. From a student standpoint, I think the Issaquah School District has been doing a very good job in terms of getting out hotspots to students. But we also wanted to consider how adults in the community also need access to Wi-Fi and broadband, especially those who may be looking for a new job during this time where many people are losing their jobs. So whether that's the city sort of is procuring hotspots to give out to citizens or opening up a socially distanced space when safe to do so for people to have access to Wi-Fi, just making sure that people do have that broadband access, those who need it the most.
And the youth board also discussed adding on actually to the great idea from the Human Services Commission, just programs for families or kids to expand on police community interactions. So we thought in a more broad sense. So for example, the youth board did in the past do a dodgeball and donuts tournament where police officers, both in uniform and in civilian clothing, joined youth in their dodgeball teams to play. So that's a great example of just increasing police community interactions, especially in this tense time. So increasing both formal and informal presence would be nice. And then we also expanded on this idea, talking about familiarizing public services. So we had an example from one of our group members talking about schools and children visiting fire trucks and just a fire station and seeing how that worked. So we thought the city of Issaquah might benefit from some programs like this. And then also talking about childcare, sort of youth and socialization. So I think this actually connects to one of the ideas from the Economic Vitality Commission, but we just want to talk about in the context of youth and how we look at it. Creating definitely more after-school programming and transportation in the near future so that 9-to-5 families can prioritize working and even looking for jobs if they have to, for their kids as somewhere to stay or somewhere to keep their focus until shifts finish and finishing their jobs. So that's the point on that.
All right, and I'm going to discuss the last point on this slide. So we definitely talked about more virtual community events. That's something that the Youth Advisory Board spends a lot of time on, is obviously programming through the Parks and Recreation Department. We had a group that put on, I believe, a Winter Crafts event last December, and I think it was pretty well attended, I believe. And so a lot of our groups are working on conferencing events, both for youth, but also adults. We are going to try and do State of Mind again this year, which has been an event that's happened a lot in the past. And so that should be coming back this year in a virtual format. And we really just want to continue to foster more community connections through events, possibly maybe in the future doing socially distanced events at the community center. Yeah.
All right. Well, great. Thank you all for your comments. We've got a couple of comments and questions, I think. Jason, go ahead.
What a remarkable group. They often say that the youth are only consumed with themselves, and I think I heard more about adults in that conversation than I did kids. I mean, you guys' compassion is quite remarkable. Thank you, Delnez. Thank you, Ryan, and thank you, Sean. I think they're all tremendous suggestions. The surveys, what a great idea to check in on the mental health and well-being of our community. And I was thinking about the small business portion of what you guys had to say. And there's so much that the young people can do to help, right? You guys are masters of using new social media and things like that that can really get the word out for some of these businesses. Most of the small businesses I know are not utilizing social media. I mean, maybe 10 to 15%. They might have a website, but they don't do anything in terms of outreach, right? They expect people to come to their website. So I think there's a tremendous opportunity there. As far as marrying something like an after-school program, more programs for young people, I'm thinking of businesses that need raw materials. You know, you could have signs saying, this business is supported by Issaquah High School, and they could put that in their windows, or use the mascot from the high school and put it in the windows to let people know that this has been approved by our young local leaders. So things like that, I think there's just a tremendous opportunity here. And, as far as being able to interact with the different departments, whether it's the police and firefighters, well done, guys. A terrific presentation. You guys did a very good job.
Great. Thank you, Jason. Sashi, you have a comment?
Yeah, I want to applaud every one of you. I really feel excited, as last time also I mentioned. I hope you remember, I said they are leaders for tomorrow. I would like these kids to keep an eye and be very vigilant about how we have handled this pandemic. You should not do the same mistake that we all have done. This pandemic should not have happened. We knew SARS-CoV-2. It was there in 2003. And then in public health, the basic thing is to close down everything and then open it as you learn more. If we were closed down for 2 months, not more, because the life cycle for this virus in a host is just 17 days. And we won't be spending trillions of dollars in doing whatever we are doing, the aftermath of it. And it was politicized, another thing. So really great job you guys are doing. You're on a very good track. But I would always say, keep science, keep track of that, be scientific and be vigilant. Keep your eyes open and all senses open to see how we are doing, what mistakes we are doing. If I hope it doesn't happen again, but if it does, when I'm more than 100 years old, you will do a good job, better job. Thank you.
Thank you, Sashi. Marisol?
Yes, thank you. I really appreciate having the youth voice in here, and thank you for your presentation. It was great. I'm really interested in, I would love to see if we can gather some information about the Wi-Fi spots. I think that right now, and after what happened yesterday with the school district not having internet for the whole day, it's important to remember that not everybody has access to Wi-Fi every day. And having, I don't know, some sort of a list just to know where, people can go in their cars if they need to, and utilize the Wi-Fi from, I don't know, businesses or the library. I'm not sure if the library has their Wi-Fi and if it reaches all the way to their parking spot, but I don't know. something like that. I think is important, just, to remember that not everybody every day has access to internet. So thank you.
Great. Thanks, Marisol. I think that is all the comments. So thanks to the members of the Youth Advisory Board. I appreciate very much your presentation. All right, so we're going to turn this back to the task force. You had an opportunity to hear from several of our boards and commissions. Now I'd like to hear from you based on what you've heard. What do you think the priorities are that we should be recommending to move forward with as part of the city's work plan for 2021? So what I'd like to do is just kind of go across my screen and call on each of you to kind of get your thoughts of what you'd like to do, what your thoughts are moving forward. So on my screen, Brookie is the first one up. So Brookie, what are your thoughts based on what you've heard this afternoon?
Well, I have a lot of thoughts, but if this is something you do each week, do you mind coming back to me to make sure I follow the same process? Thanks.
It's not something we do every week, but we will come back to you. All right, that's I think it's on in alphabetical order, maybe. That's why Brookie was on top there. Next would be Mike Brennan. That's not alphabetical order, but you're next on my screen, Mike. What are your thoughts?
But it's close to alphabetical order. Thank you. So just a couple of thoughts. There was a lot of really great ideas and a lot of work that's actually underway. So just a couple more, maybe my thoughts are more broad. First, we've spent a lot of time over the last number of months dealing with a situation where we're trying to advance things that are helping people do things as individuals, meaning we don't have the ability to gather as groups, our businesses are restricted in how many people can be indoors, etc., and or activities that are where people are separated. But as the vaccination program expands and more people are protected, thinking about how does the different phase or different phases of that start impacting the way that we're implementing these programs. So it allows for, the smaller gatherings can start to occur. What might that look like? Are there some new ideas now that we can have, say, 50 people come together at a time? How are we going to deal with people who are vaccinated versus not? Because that's going to become a big question in a lot of people's mind. Do we, people are going to want to know if you are or not. So that's going to be a communication challenge, and I think even a kind of a public perception management issue we've got to deal with. So I think just thinking about the phasing as we advance the vaccination and protection, are there new things that we should be thinking about that are more than individual activities or activities where people are maintained separated? So just one thought. The second one is there's a lot of really positive that is coming out of this, even though this has been a very difficult 10 plus months now and continue into this year. But there are a lot of things that have happened, and a lot of credit to a lot of people and really creative thinking and hard work, but creating new outdoor activities that you hadn't created before, the Parks Department putting in new programs, really trying to make the best of what we've got. But some of those things you ought to think about, how do we carry the good things forward? I mean, after we get out of COVID, there are some things that we're doing during COVID that we wouldn't have done otherwise. We're going, wow, that's really something we should think about continuing forward. Community engagement that's happening, how we're supporting each other, that sort of stuff. Local business support, the Issaquah local program has been, really a great program. And then finally, just ways to connect with each other. In fact, what we're doing right now is not something we would have done back in 2019. We're all together on a screen here. It's an opportunity, it's a challenge. But so I guess the point again being, make sure we're capturing the positive things and try to make sure that we continue to carry those forward. And I think there's a long list of them.
Great. Thank you, Mike. Next on my screen is Marisol.
Thank you. I would say that one thing that I really would love to continue talking about, it's about getting or keeping us outside. What the Parks Department was sharing about having outdoor equipment for exercise, I think that's very important right now. I feel like as people, as we have been dealing with this for almost a year, we are all tired. We are all tired, and we have been developing these ways of surviving, and we don't know how long it's gonna last, but just by being outside is helping us, and not everybody has the same ability to do it. So having something that anybody can use, I feel like that's great. I see a lot of people go to the mountain. Well, not everybody can go to the mountain, or not everybody has the ability to walk. Not, that just thinking outside of the box on things that more people can do outside. And just threading through that is mental health. It's very important to think about that right now. I feel like the more we go into this, the more people are, I mean, as I said before, just dealing with it by whatever they have around them, and just by checking on people around us. I feel that's important. Many times when you move here, I will like speak for myself. You move here, you don't know anybody, you don't know what the customs are, and people who are around us and are new, they don't know what to expect. And moving through the pandemic, it must have been the hardest things for a lot of people, because they don't go to school, they have work from home. So just checking in with people around us is important. So I don't know, just thinking about that in our neighborhood or something like that. And yeah, I really like what Mike was talking about, just thinking about how are we going back and keeping the good of what we have learned. So, thank you.
Great. Thank you, Marisol. Trish?
Okay. Can you hear me okay?
Yep.
Okay, so I'm going to try and make it easy because I know you have a lot of people to go through. I thought all the suggestions that came up this afternoon, evening were great. So, I mean, anything we can do that doesn't really have an expense implication would be great, because then, there's no budget impact. I definitely am on board with what both Mike and Marisol said. Whatever we can do to encourage the outdoor activity. And then number one priority is helping the community understand, this whole vaccination process. I mean, I know that there was just an announcement that came out at the beginning of this week that it's going to shift or change what the states might do. And I know that Olympia already published what their schedule was, and now their schedule might change depending on this most recent announcement that came out of Trump's COVID task force. So, I mean, that's really the biggest thing, is to make sure that everybody's on top of that. My understanding is that people are calling Bartell's and CVS, and the CVS we have here at Issaquah, because it's in Target, it's not even one of the ones. You have to be my understanding is it has to be a freestanding CVS to be part of this distribution program. Okay, that's it.
All right. Thanks, Trish. Pavel, then Ron.
All right. So, can you hear me well?
Fine.
I mean, overall, I think our committees in Issaquah City doing great job, and all the plans are awesome. The one thing that I feel very, like, personally for me, that hasn't been touched and I didn't hear well at all is about our elderly population. I have an 80-year-old mom, and believe me, it's just getting frustrated to the frustration point, like keeping positive her throughout all this pandemic. And I think we need to come up with something that really will help elderly population. I think we need to think about what our normal life will be, hopefully soon enough. The vaccinations effort are great, and I think what Chris was telling us, with 40,000 people being vaccinated a day, it's not feasible at all. But at least half of that we are capable, and that will be absolutely enough for our people trying to get back to normal lives. And so I think I would down the road like to hear more plans that are, to directed towards more elderly population and their mental state. That's
great. Thanks, Pavel. Ron, and then Sashi.
Yes, thank you very much, Mr. Bobkowitz. So I've got a couple things. I'll make a quick recap here. I think the e-info information stations that was talked about earlier today, Jason Voss brought that up. I can't commit to Visit Issaquah would like to participate in that, but being that I am on the board, I'll certainly bring it up to them if that's something that you would like me to do. I'll just wait for you guys to ask me for that. And then I think a vaccine station would be really nice to have, something that's local. Because the sooner we can all get vaccinated, the sooner we can all get back to normalcy. And I think from a community standpoint, our residents would really appreciate having something that's local and quick. And then as far as senior housing, to Pavel's point, my mom is 87 years old. She's at University House, and she's scaling the walls. She is bored. She's going bat crazy. And I don't know what to do. Is from an entertainment standpoint, I'm very limited because I'm not part of her household, but maybe working with some of our senior centers to incorporate maybe an art docent type thing or some displays or something to give those people an opportunity to get out of their apartment in a safe way, I think would be really good for their mental health. And I don't know how to answer that. I've been scratching my head and trying to figure out something, but that's all I have to contribute for tonight. But thanks for asking for the questions.
Great. Thanks, Ron. Sashi, then Jason.
Yeah, thank you. I think very important, everything is important, but I think most important right now is vaccination. And just giving vaccination is not enough. None of those vaccines are 100%, they don't have 100% efficacy. So it could be 94%, 90%, or even less. So just giving a vaccination is not enough. After that, we should do the immunity test to find out who is free to roam around. And I think it will be like a normal life for a person who's vaccinated and is totally immune with good titer in ELISA test. And then he or she can go to shops around and walk around and do whatever. And then, considering we are 33 or 340 million people in the world, in our USA, and everybody has to be vaccinated, we need to vaccinate nearly 1 million a day. And considering our state, we can do that calculation. By the time everybody is vaccinated, it will be time again, maybe, to be revaccinated. Because if the immunity does not last that long, or even a year, we'll have to keep going on. But I heard somewhere, there is a chance some people who were infected with SARS-CoV-2 in 2003, they have immunity for, some of them have immunity for 17 years. So there is some talk about it. We don't really know. Time will tell. We had to hurry up and come up with some vaccinations. A lot of people are still making vaccination. I'm sure there'll be good research. But side by side, like having open gyms and stuff like that, it has to go on side by side. But yes, if we do immunity, we have to do immunity tests as importantly as vaccination. Thank you.
Great. Thanks, Sashi. Jason, and then Marlene.
Thank you, Administrator Bobkowitz. I think some of these things are unfortunately going to be out of Issaquah's hands. They're either going to be up to the county or the state, as far as sites, as far as green passports, things like that, that I know are being discussed. I don't know if Issaquah is going to have the capability or even the powers to be able to make certain things happen. Trying to put a number on a priority list on this is pretty difficult. I mean, I think communication as far as getting people vaccinated is a big one. That's going to shorten this pandemic, depending on how many people are willing to get the jab. It could go on for a year, it could go on for another 2.5, depending on how many people are willing to line up. So communication is important. Economic vitality. I mean, when this is over, we are going to be hopeful that we still have businesses to frequent. So making sure that our local businesses stay afloat, I think, is probably right up there. And then human services, of course. We need to make sure that our community is healthy on the other side of this, not only physically, but mentally. So putting a number on the priority list is going to be hard, but I would say probably economic vitality and human services are probably going to take precedent over other ones, as much as I love the parks and boards. And all of these things are kind of intertwined, right? So that's part of our health, is getting the parks and boards. But like I said, if you were to actually ask me which ones, it's probably going to be economic vitality, and it's probably going to be human services that we really need to pay attention as we move forward and try and dig ourselves out of the pandemic. To Miss Corey's presentation, and hi Kathy, haven't seen you in a while. I was kind of wondering if Issaquah businesses, and I'm sure you guys have probably already started doing this, but if there is a way to kind of cross-pollinate between the businesses, right? So if this business needs meat, maybe they try and get it from a local supplier. I mean, again, meat's kind of a horrible example. But as far as getting Issaquah businesses to cross-pollinate with one another, maybe just for the time being, right? Because a healthy Issaquah is going to keep both businesses in business. So maybe for a year, you try and get some of your supplies, your resources, your raw materials from a business in Issaquah. So just an idea. I know Miss McCory, as part of the Chamber of Commerce, talks to a lot of our businesses. So just an idea to see if we can get some cross-pollination. And then I did hear from Pavel and Ron about the elderly. Here is a tremendous opportunity for our youth. Our youth board, if we charge them with it, should be able to find out a way to interact with our elderly. A lot of middle-aged people are trying to get their kids on Zoom. They're trying to do at-home learning. They're trying to maintain jobs. It's very difficult for them as it is to try and think of ways or devote time to some of our elderly. As anyone who's ever visited Belmont up there on Providence Ridge knows, elderly people love children. They love youth. So if we could get our youngsters, I mean, I don't even know what it would look like. Do you do a play outside for them? Something like that. But if we could get our youth to be able to take some of that burden from our elderly off, there's another after-school program. And like I said, they're a perfect marriage, because right now, young families, moms and dads, are trying to teach their kids, are trying to hold down jobs, are trying to pay bills. Our youth are currently not at university. They're doing at-home learning. So there's an opportunity for our youngsters. That's my piece.
Great. Thank you, Jason. Marlene, our camera was off. Is she there?
I'm here. Can you see me and hear
great.
me?
There you are. Great. Thanks, Marlene.
Okay. No problem. Love what everybody has said today. I think, coming from the parks board as well, I think we know it's safest outside. We know it's also great for mental health. So for me, I think there's really some really great quick wins that are, probably budget savvy, that we can get after right away. So I'm really interested in that. I know there's a school board meeting tonight. We haven't talked a lot about schools, but obviously priority is getting kids back safely. So anything we think about, on the economic vitality, I hope it is not at the expense of safely returning to schools. So just making sure we are being very thoughtful about when we start opening restaurants, gatherings, et cetera, that it doesn't come at the expense of getting our kids back. So that's my 2 cents on sort of where we're headed.
Great. Thanks, Marlene. So I think last then is Brookie. Did I miss anyone else who's a member of the task force? Oh, Nina. I'm sorry. We'll do Nina and then we'll go to Brookie. I'm sorry, Nina. The faces keep moving. I thought I was keeping good track.
Yeah, they do. Thank you. And this is Nina Milligan. And I'll be brief. Health, safety, and economic vitality, of course, the overarching. But I think the task at hand was to try to look at these specific ideas and choose which ones we would prioritize. And I liked a few in particular, and the purpose that for which I chose them was that as to, I think what Jason said earlier, that the things have not just one impact, but impact many of the objectives. For instance, pedestrian prioritizing for safe crossings and pedestrian ways downtown would impact positively economic development because it would be getting more people to be spending their outdoor time in central Issaquah or Old Town. Same with the online Waypoint tour app on your phone. That I think evolved to a real doable thing, and sure you could visit Issaquah or an agency like that to provide so that we aren't burdening the city with just one more thing to do. I also thought that the soliciting stories, the Chamber of Commerce idea, helps not only economic development, but then speaks to the well-being of our community and our mental health. So the last one that I want to speak to is the check-in idea from the youth board. Not only check-in surveys, you know how surveys are, you get some people to participate, but I was thinking, why not be really bold? We just came off an election season where people call you and say, hey, how are you doing? And have a meaningful conversation with you, and then they ask you for money. Now, what if they just called you and had a meaningful conversation with you? This could come from the people on the youth board. It could come from staff, city staff. What if the caller ID was city staff checking in and people enjoyed a moment of interacting personally with members of the community, seeing how they're doing, learning from them? I think even staff would enjoy that. Overall, though, I think most of these things could be partnered with other organizations so that the city stays lean after this last year's cutting back to the basic services provided by the city. I would like to be very mindful about what we adding back on. And that's all I have. Thank you.
Great. Thanks, Nina. Brookie?
Yes, thank you. Thanks, everyone. Great to see everybody's face. Just brief for me, I think number one for me is vaccinations. As soon as we are able to get to that herd community, we'll all be better off. And so the more that I think that we can help with communications, where to go, this group is up next, it's time for you to call this number, here's how it works. I think those will all be super helpful. I think, as I said, I think there's going to be a lot of opportunity in the area. It's just kind of starting to ramp up now, but I think within the middle of February, there's going to be a lot of places that we're going to be able to take advantage of. And then for me also, as Marlene mentioned, we didn't talk about it, but schools. I think that for mental health, for the economic piece, for everything, like if we can the more we can focus on vaccines, getting the teachers safe, and then getting people safely back into schools is just going to help us all get there so much sooner. So those would be my my two priorities.
Great. Thank you all for those wonderful suggestions. I heard a lot about vaccines, heard a lot about mental health, keeping people outside, engaging with seniors. What we'll do is we'll share all this information with Mayor Pauley. We're going to be giving a report to the City Council on January 26th. And I know that from this discussion, she's going to be making recommendations to the council with some additional things that we need to do. So we'll keep you posted on those specifics as time goes on. But thank you all for all the good suggestions. We're nearly at the end of our time, but what I wanted to do was share my screen and talk a little bit about what we're doing with vaccinations. So let me see if I can do this easily. Find the right PowerPoint. And that didn't work. Oh, wait, here we go. Sharing a whiteboard. I don't want to share a whiteboard. All right, that's not working. Hold on just a second.
You had it up there the first time. The PowerPoint was up.
Oh, do you see PowerPoint now?
Not now, it's a whiteboard.
Okay.
There you
Now
go.
do you see it?
Yep.
Okay, great. Right. Great. So Mayor Pauley created the Issaquah Vaccine Community Partnership. They had their first meeting on Monday. The idea of the partnership is to bring together a whole variety of partners throughout the community to focus on community vaccination efforts. Thus far, we have Eastside Fire and Rescue, the Issaquah School District, the Chamber of Commerce, Swedish Hospital, and various staff from the city, our emergency management staff who coordinate our citizens emergency response team, and our medical volunteers to start gearing up volunteers to help with these programs, our human services staff, our senior services staff, and our communication staff. This is the COVID vaccine phases. I'm sure many of you have seen this in the press. Unfortunately, it looks like this is going to continue to be a moving target. We are right now on A1 and A2, so that's high-risk healthcare workers in healthcare settings. So as you heard from Chris, Swedish Hospital, other healthcare providers have been in that category. High-risk first responders, that's included firefighters and some police officers. Long-term care facility residents, many of the long-term care facilities have contracted either with CVS or Walgreens for on-site vaccinations, and that has been happening since late December, and then all other workers at risk in healthcare settings. So I think as Chris mentioned, these A1, A2 categories, many have already had the first inoculation, many more now are getting a second inoculation, so that group is pretty much going to be completed here in the next couple of weeks. I think the next question is what comes next? Under the state's plan, B1, all people 70 years and older, and 50 years and older in multi-generational households. That is the current plan, but as been mentioned today, the federal government has said it should be 65 years and older, so we're looking to see what impacts there would be there. There's also an interest within Washington State to begin providing vaccinations to all K-12 teachers and school staff members. So we're hearing from the state of Washington that there could be changes as soon as tomorrow to what that B1 looks like. And so we'll keep you posted. Certainly part of our commitment, Mayor Pauley's commitment with the community vaccine partnership is communication and making sure that people know where they can go when things, when vaccinations are available. This chart shows the remainder of the groups. And again, my experience just in dealing with this pretty much every day for the last few weeks is we can expect to see this all change, either move up or be recategorized. But I think the focus now is on what that B1 looks like and what are going to be the opportunities to do that. We have been talking within the community about mass vaccination centers. The Issaquah School District has identified school sites that are available. The Swedish Hospital has been talking with the school district, and there's hope that one of those school sites would be designated as a mass vaccination center, again, hopefully within the next couple of weeks. The issue of mobile vaccination units, if you saw the press in the last couple of days, the Seattle Fire Department has been given authority to begin mobile vaccinations using firefighter paramedics. Eastside Fire and Rescue has also made application to the state to do that. And so hopefully you'll be seeing news about that. That would be their first priority would be going to smaller senior living facilities. The larger ones have contracted, as I mentioned, with CVS and Walgreens. So this would be for smaller units with seniors and perhaps individual seniors who cannot get out. So the Eastside Fire and Rescue is focused on that. We'll continue to focus on communications. And as I said, there are changing phases and we'll need to be thoughtful about those changing phases. So vaccinations are going to be a big part of what we talk about in the community and with this task force as we move on. So any questions about vaccinations or the work of the mayor's community partnership? Sashi.
I have a request. You know, when I see some senior figure on TV taking vaccination, it really inspires people. There are a lot of people who don't want to take vaccination. I would like to see our mayor and maybe coming on TV and taking vaccinations. So if it is possible, all that should be done.
There will be a camera of some sort with her. I guarantee you that. Any other thoughts or questions about vaccinations? All right, so we're at the end of our time today. We were also going to give you sort of a general update on some of the other projects. You've heard about some of the other work we've been doing through the course of the afternoon, so we'll leave those updates for our next meeting. Joanne, I think we committed to once a month moving forward, at least through the first quarter or so. So we'll plan on meeting again on Thursday, February the 10th. We'll provide an update as to the council's discussions about additional focus areas based on the recommendations of our boards and commissions that you've heard today. We'll talk about vaccinations. We've not had the school superintendent, Dr. Thiele, with us. Perhaps I'll invite Ron to join us and give us an update on what's been going on with the schools. I know they're very focused as well on vaccinations and are gearing up to make sure that as soon as the state of Washington gives permission, they have ready access for their staff members. So I'm sure that in a month's time, there'll be more to talk about with that. So if there's any final questions or comments, young lady whose name I butchered the last time, Delnaz, is that closer?
It's Delnaz.
Oh, that was closer. Okay,
Yeah.
yes. What's your?
I go by Del. Just easy.
Del, even better.
Sorry, I didn't know how to like raise my hand or whatever in the like chat, so I just copied you guys. But about the like connecting the elderly population with the youth. I am the project lead of our Community Nights project team in YAB. And we actually are having our first game night on the 30th. But we do conferences in my other teams as well. Like I'm part of the social justice conferencing team and the environmental conferencing team. So we got like, I think over 30 people last time on Zoom. It was amazing from like all over the country. So I think it's super easy to connect the elderly population over Zoom with the youth. And I know we like to do it in person, but I don't think a lot of people would be comfortable with that, even with social distancing. But Jason and I think Pavel, I don't know how to say your name, but I would love to keep in touch with you guys if I could get your email. But we could definitely talk about that. And I think we could get like an event out or every week or something, super quickly actually, because I mean we do conferences in about a month and with like guest speakers and everything. So just a community Zoom meeting would actually be super fast and just like 1 week of planning. So yeah, I just wanted to put that out there. I know we have a priority list, but this could be done really quickly and really easily, and my team could, you know, take control of it with a little bit of help from you guys. So I just wanted to put that out there. Sorry for, you know, extending this longer than it needed to be, but yeah. So
No,
I will drop my email in the chat, and if you guys would like to email me, whoever's like interested, I won't need that much help, but if you are interested, I'd love to get some input on what we should do with that. So thank you.
Great. Thank you very much, Del. Really appreciate your comments and enthusiasm. Any final thoughts for the group? And there's Del's email address. All right, then. Thank you very much for your time. Sorry we went a few minutes over. We'll see you all on Thursday, February the 10th. Take care. Be safe.
Bye.